Hi. I'm here to pick up my mom's prescription for a new medication. Can you tell me more about Awiqli and how it differs from Lantus?
Hi, I'm Kim, the pharmacist. I'd be happy to help you with that. Please, have a seat in our counseling area.
Thanks so much.
May I have your name, please?
Sure, my name is Linda Bryan.
Nice to meet you, Linda. And what's your mom's name and age?
Her name is Elizabeth Charles, and she's 62 years old.
Got it. I see the doctor stopped Lantus and switched your mom to Awiqli. What made your mom see her doctor today?
Well, my mom is diabetic and currently on Lantus. She has trouble injecting herself, so I take care of her medication. I recently got a new job in another city, which makes it hard for me to be there all the time. I can come back weekly to help with her meds, though.
I completely understand. That must be tough for both of you. Did the doctor mention anything specific about the new medication?
Not really.
Okay, before we dive in, can I ask you a few questions about your mom's general health and lifestyle?
Absolutely, go ahead.
I see from her profile that she's taking metformin 500 milligram twice daily. Is she keeping up with that?
Yes, she's been consistent with it.
Great. And she's also on glyburide 5 milligrams twice daily. Is she still taking that?
Yes, she is.
Awesome. Is her blood sugar under control?
From what I know, it's been within the normal range.
Can you tell me what her readings have been like?
I'm not entirely sure, but I know she's been doing well.
That's good to hear. I also see she's on rosuvastatin 10 milligram once a day. Is that for protecting her heart or managing her cholesterol?
It is for protection.
Understood. And I also noticed she's on Lantus 20 units every day. Is she consistently taking it?
Yes, she is still taking it every day.
Got it. Has she experienced any side effects from her medications?
No, she's been doing quite well.
That's great news. Does she have any other prescription medications?
No, just those.
How about over-the-counter meds?
None at all.
Any herbal supplements?
Just vitamin D.
Perfect. And any updates on her allergies?
No, nothing new.
Does she smoke or drink alcohol?
No, she doesn't do either.
How's her diet these days?
She eats pretty healthy, actually.
That's good to hear. Does she get any exercise?
She walks her dog every day, so that helps.
That's fantastic. Would you mind giving me a couple of minutes to double-check my references?
Sure, take your time.
Thanks for your patience. Based on what I found, Awiqli contains insulin analog icodec insulin. It is a new type of long-acting insulin injection. It comes in a pen, and each milliliter contains 700 units of insulin, meant to be given subcutaneously. The main difference from Lantus is that Awiqli is administered once weekly instead of daily. That means just one injection a week, which might be easier for both you and your mom.
That sounds really helpful.
Alright, so she needs to stop the Lantus, and the very next day she'll start Awiqli. For the first week, it'll be 210 units, then 140 units the week after. The first dose of Awiqli should be taken the day after her last Lantus shot. Does that all make sense?
Yes, that makes sense.
And when was her last Lantus injection?
She took it last night.
Would you prefer to start the transition to Awiqli tonight? Or would you like to wait a day or two to ensure your mom is ready for the switch?
I think we can start tonight, but I still have some leftover Lantus. What should I do with it?
I totally get it. Since you're ready to start, the leftover Lantus can be safely returned to the pharmacy for safe disposal.
That's great to hear.
Just a heads up, the Awiqli pen dials in 10-unit increments, unlike Lantus, which dials in 1 unit. And make sure to visually inspect the solution for any particles or discoloration before use. It should be clear and colorless.
That is really good to know.
Great! Since we're transitioning her from Lantus to Awiqli, she'll need to monitor her blood sugar more frequently, especially during the first few weeks, to make sure her blood sugar level are staying within range. If she notices any symptoms of low blood sugar like shaking, sweating, or confusion, she should take something like juice or glucose tablets to bring it back. And if her blood sugar is consistently high, let her doctor know, as adjustment might be needed.
I'll keep track of that. I will stay with her all this week before I start my new job.
And if she misses a dose, she should take it as soon as possible. She can go back to her regular dosing schedule as long as there are at least 4 days between doses. Otherwise, she'll need to stick to the new weekly schedule.
Yeah, that's totally manageable.
Perfect. Just wanted to check. Does your mom have a glucometer at home? And is she comfortable using it to check her blood sugar? I just want to make sure she has everything she needs to stay on top of things while you're helping her out.
Yes, she has a glucometer with sensor, so it's pretty easy to her to check her blood sugar.
That's great to hear. Also, keep an eye out for any rare but serious side effects, such as a rash all over her body, swelling in the lips or tongue, or difficulty breathing. If any of those happen, stop the medication and get her to the emergency room immediately.
Got it, I can handle that.
And because she's using blood sugar-lowering medications like metformin and glyburide, The doctor might adjust those doses and timing based on her blood glucose levels. So it's important for her to keep her regular doctor visits.
I'll keep that in mind.
Remember, the unopened Awiqli pen can be stored in the fridge from 2 to 8 Celsius degree until the expiration date, or for 12 weeks out of the fridge in room temperature below 30 Celsius degree. Once opened, it should be used within 12 weeks, whether in the fridge or not.
Oh, that's awesome. Good to know I have a bit of flexibility with storage.
Here are a few helpful ideas she might want to try. For example, wearing a medic alert bracelet could be really helpful. It has important info in case of an emergency.
I will definitely do that.
Also, she should stick to her regular meals and avoid skipping any to prevent drops in blood sugar.
I'll make sure to do that.
And don't forget to keep her vaccinations updated.
I'll definitely take care of that. Thank you. I really appreciate it.
No problem at all. We can give you a call after 7 days to remind you about her second dose and assist you with adjusting the pen correctly.
Yes, please do. Thank you for all your help, Kim. You have made this so much easier.